All right. So, first of all, good evening and welcome to the lecture number 3. And today we are going to talk about the sports injuries and its management in the foot region. So, in the last two lectures, we have discussed about the basic introduction about the sports injuries. In the second lecture, we have discussed about the different components of the assessment, right? So from the today's lecture, we are going to talk about the important injuries, right? Important sports injuries in the foot region. So in the forthcoming lectures, we will talk about the other injuries in the hip, knee, and the upper extremities and the vertebral region, right? So today we will start. The first important injury that you can suspect in the foot region is turf toe, right? So this is the common injury that you can suspect in the players or the participants who are involving in any type of field games or in the any type of athletic games. So let me explain the important component of this problem, that injury. It is an injury or tear to the capsule surrounding the joint at the base of the toe, that is especially the great toe. So the great toe means we can say it's a first metatarsophalangeal joint, right? So generally you can see it is a hyperextension injury, right? So generally the joint is covered with a capsule, right? So if there is an excessive force over the joint, it may rupture and it may lead some issues, right? So some problems. So if it happens in the first metatarsophalangeal joint, so you can say it is turf toe. So what are the problems, right? What are the symptoms the person or the player shows? He shows in the instability or dislocation of the joint at the base of the toe region. So if you move the joint, right? So if you make some movements, so you can say there is a instability, or you can find there is a dislocation, or you can say there is a forward or the backward dislocation of the first metatarsophalangeal joint. Along with this, you can suspect there is a cartilage rupture, right? So you can see there is a rupture, right? So cartilage wear of the back big toe in that particular joint. Or you can see there is arthritis, right? So arthritis is the you can say it is a post-traumatic arthritis, right? If there is any injury, right? So in the later stages, the joint become inflamed, and you can say it is a post-traumatic osteoarthritis. So when you see the mechanism, right, how it happens, right? So you just see this picture. The player is going forward. He is landed with hyperextension at the first metatarsophalangeal joint, right? You can see the whole force is passing through the particular joint, which may rupture the joint surfaces. See, the turf toe occurs when the joint hyperextends, and there is a trauma to the joint capsule, right? So you know about joint capsule. The capsule means it is a covering of a joint, right? So if you take any synovial joint, you can find a capsule, right? So inside the capsule you have the synovial fluid and synovial membrane, and you have articular cartilage. So if this capsule is involved or if the capsule is ruptured, there are so many issues, associated issues you can expect. Generally, the person's heel will be in the air, and there will be pressure down on the toes enough to cause tears along the joint tissue, right? So you can see this picture, right? So it is clearly shows that the person is landed with a hyperextension of the first metatarsophalangeal joint, and there is a more forces on this joint, and there is a chances of rupture of the capsules in the joint. So this sort of action occurs from sudden stopping and starting, right? So these are the different positions that the joint can be ruptured, right? From changing direction quickly, or from slamming the toes in the ends of one's shoes, right? So generally along with that, along with this injury, you can find there is injury to the tendons. There are various muscles which are passing through the joint. So these tendons are get ruptured, and you can find there is a later stages you can find the inflammations, right? So generally what happens finally, there is limitations of the movements. Let's see the important stages, right? So when you see the important stages of this turf toe, you can classify it according to the signs and symptoms, right? So according to the signs and symptoms, we classify the turf toe into three grades, right? So we have three grades: grade 1, grade 2, and grade 3. So the first grade, you can say it is mild, and grade 2 is moderate, and grade 3 you can say it is great. It's a severe stages of turf toe. So what you can see in the grade 1, there is a slight tenderness and swelling, right? So if you press that region, right? So if you press that area around that joint, you can find there is a slight tenderness. You can see when you go for the observation, you can find there is a slight swelling. But there will not be any rupture of the blood vessels, so there is little or no bruising. But the person might be having the full range of movement. Then if you see the second grade, that you can say it is a moderate type of turf toe, or you can say it is a grade toe, you can see there is a slight bruising with tenderness arising in the surrounding areas, right? So you can see, what do you mean by bruising? Means you can have a rupture of the blood vessels, right? So you say in the moderate type, or you can say in the grade 2 turf toe, there is a light rupture of the blood vessels, right? Along with that, you can find there is a slight or minimum restriction of the range of motion. But these two features, that means the bruising and the limitation of range of motion, that you cannot find in the first stage, right? So in the first stage, you have only tenderness and swelling. There is absence of bruising and limitation of range of motion. But in the grade 2, there is a mild rupture, or you can say the bruising, and you have a limited range of motion. But the grade 3, so you can say the grade 3 is a very severe stage. So you can find all the features, like you can find there is a bruising and tenderness. It is very severe, right? So you can say the grade 3 is a severe stage of turf toe with accompanying swelling, right? So always there is presence of swelling, and the person is not able to walk, and the normal activities of daily living will be restricted, right? So painful, and the range of motion will be extremely limited. So the person will be having very much limited range of motion. So the toe can look disfigured and out of place, right? So you can say generally it is dislocated. See the generally, so if you find this type of problem, right? So this type of issues or this injury can be found in the players who are playing sports in the fields or in track events, right? So you can say generally the games are classified into field games and the track games, right? So in both type of games, right? Those who are, so field games means those who are playing in the field, like you can say football, volleyball, like rugby, right, American soccer, cricket, right? So all these games comes under the field games, and there are some games which comes under the track games. So these are the broad classifications of the games. So track games, you can say the athletes, right? So for example, the type of marathon, you can say 100-meter relay, 200-meter relay, 400-meter relay, the high jumps, long jumps. So all this comes under the track, right? So the injuries which occurs in these field games, or you can say the track games, right? So generally, if you come with a person with a turf toe, the management, right? So the management means rise management, right? So rise means rest, ice, compression, and elevation, right? So this is the initial treatment for the players or for the turf toe injured persons, right? So rest means immediately don't do anything, right? So let the person to take rest comfortable time, at least to 2 to 4 weeks, to get recover the structures, and apply immediately, right? So immediately you start applying. Yes. Give the treatment, right? So in the manner of rest, ice, compression, and elevation, right? So ice means, just apply the ice over the injured area, the main reason for applying ice is the sudden reducing the swelling, right? So you can reduce the swelling. Apart from that, you can apply some crab bandages, right? So it is applying compression and let the leg or let the extremity to be in an elevated position, right? So this is the common treatment, right? So this is the common treatment for all type of sports injuries, right? So the rest, ice, compression, and elevation. Right. Next, if the problem is still existing, right, you can prescribe some anti-inflammatory drugs, right? So this is not our role, right, as a sports physician, right? So can prescribe the drugs to the injured person, right? So you can go for non-steroid anti-inflammatory drugs, and if necessary, right, so you can go with some modified footwears, right, for the player. Right, so if necessary, right, so if you suspect if it is a grade 2 or grade 3 type of turf toe, you can suggest or you can refer the patient for some advanced investigative procedures like X-ray or CT scan or MRI. Or if required, right, so if you find there is a grade 3, that is grade 3 or severe type of turf toe, the person may be indicated for surgery for the recovering or stabilizing the joint. And yeah, after surgery, you maybe go for some type of cast and walker boards, right? So these are the general management for the turf toe, right? So in all types of, so grade 1 and grade 2 turf toe injuries are generally treating with the body wrap, right? So you can see this, right? So the purpose, right? You can see this picture. The purpose of this strapping, right? So this is, you can say strap, or you can say it is a shaping procedure, right? So in which what happened, it is stabilized, right? So this is the main purpose of this shaping or strapping procedure, is to provide the rest to the metatarsophalangeal joint. So you can see with a body wrap. So although it is not recommended, patients with grade 1 injury, right? So this is generally applicable for grade 1, or you can say it is a mild one, mild type of tough toes. It is injured. This is usually only for athletes who must finish a game or sports tournament. We of course recommend taking the safe route to prevent the injury from getting the worse, right? So generally, immediately after the injury, right? So to prevent, so the main purpose of applying this type of taping or body wrap is to prevent the further injuries, right? So you can see, so if you mobilize, right? So if you mobilize with the adjacent toe, what happen? You can prevent the further injuries. So you can see the grade 1 injuries can usually recover in 3 to 5 days, right? So because it is a mild type of injuries, right? In 3 to 5 days without any complications. So because it is a very mild type. And if you see the grade 2, right? So in the grade 2, it is you can say it is a moderate type where there is tenderness and swelling is there. Along with that, you have mild bruising and slight limitation of range of motions, right? So during this time, patients are encouraged to limit the movement, weight bearing on the toes, as well as to avoid strenuous activity during the recovery period. Right, so in the grade 2, we should ask the person to take the complete rest, right? So we should not allow the person to go for weight-bearing activities, or immediately we should ask the player to stop the game and ask him to take immediate care for the problem. And in the grade 3, it is a severe stage of turf toe. It's a little more serious and may require an MRI or X-ray to ensure there are no broken bones or a toe joint dislocation, right? So we already explained the grade 3 is a severe stage of turf toe. So you can suspect there is, along with rupture of this capsule, you can suspect there is a fracture in the bones, right? So in the metatarsal bones or in the phalangeus bone, or you can suspect there is a chances of dislocation, right? So we should prescribe, we should refer the patient immediately for X-ray and the MRI. So the X-ray will be helpful to identify the problems in the bone, especially the fractures, minor fractures in the bone, or MRI will be helpful to identify the soft tissue problems. So go for these investigative procedures and make diagnosed properly, and you go ahead for the proper treatment, right? So generally, the surgery is the ideal treatment for the grade 3. right? Apart from that, as a physical therapist, you have some exercises for this patient, right? Right. So the first one, you can say, let me. So the first one, so these are some of the exercises. You can go through it. I think you might be knowing all these exercises. Cough rises, you see, just ask the patient to stand with the support of a chair, right? You can ask the patient to raise the leg. So this is the type, right? So these are the later stages exercises, right? So in the later stage, right? So not in the initial stage, right? So you can make the rehabilitation phases into three: initial stage, middle stage, and the later stage, right? So generally, once the patient is getting trained, right, you can go for these exercises, right? So you can see the first one, you can say the cough rise, right? And the second type of exercise, angled range of motion exercises, right? You know, immediately after any injury, right? So in the toe region, right? So or in the foot region, you can suspect some type of restrictions, right? So the joint is immobilized for a long period of time, so which may lead traumatic stiffness, right? So that is known as post-traumatic stiffness, or if the joint is in an immobilized state, which may limit the range of motion. So there is a need of some range of motion exercises in the related joint as well as in the ankle region. So you can say you can go for some type of ankle range of motion exercises, especially plantar flexion and dorsiflexion, and inversion and eversion, and flexion and extension of the great toe, abduction, adduction, right? All such type of motion exercise can be taught to the players. And you can say the another exercise, you can say marble pickup, right? So you can see the main muscles which are working, because along with this you can suspect some type of muscle tightness, right? So you can see the tightness of the muscles, right? So in such cases you can teach some type of free exercises, right? So these are the free exercises. You can prefer different type of exercises, right? So you can see, I'll show you some other exercises. This is known as marble pickup, right? So ask the person to make the curve in the plantar region, right? So so in this stage, right? So during these exercises, the plantar flexors are getting activated, and you can keep a towel or cloth in the floor and ask him to take that, right? So there are various layers of muscles, right? In the plantar region, in the plantar aspect of the foot, you have 4 layers of foot. You have different muscles, and you have very small muscles are present in the foot region. So by means of doing these activities, these muscles are getting activated, and the properties of the muscles are maintained. So next one, as a physical therapist, right? So you can go for some type of taping procedures, right? So you can see the pictures. So these are the taping procedures for the tough toe, right? You can see there is a anchor and there is a stirrup, and the area is stabilized with the help of a tape, right? So this is the method of application of taping, right? So I think this is a separate course, right? So sports taping, right? You can see there is a tape which is applied in the top of the great toe, and the second tape which is applied in the bottom of the metatarsal joint, and the area which is involved is stabilized with the help of a third tape, right? So this is the method of application of taping for the tough toe. So again, the tough toe means it is a common sports injuries in the game, in the field games as well as in the track games. It is a hyperextension injury, right? So it is usually you can suspect this type of injury in the first metatarsophalangeal joint. Right. So next, we will discuss about the important problem in the sports persons or Morton's neuroma. Right. So this is the common problem that you can expect in the sports or persons who are involving in any type of games. So what does it mean? Morton's neuroma means it is a swelling of a nerve and scar tissue arising from the compression of interdigital. Yes. Right. So this is this is a type of neuroma which is compressed between the third and fourth metatarsal bones, right? In the foot you have 5 metatarsal bones, right? 1, 2, 3, 4, and 5. You can see this picture, right? So there is a nerve, right? So there is a small nerve named interdigital nerve, right? So there is a nerve named that is known as interdigital nerve, which is passing through these third and fourth metatarsal bones, right? Due to the continuous application of the forces, right? So due to application of the forces, what happens? This nerve is getting compressed, right? You can say it is like an entrapment, right? You can say entrapment neuropathy, right? So we used to say the compression of ulnar nerve and the epicondyle, or compression of the median nerve in the right. So same like this, right? Compression of the common peroneal nerve in the fibula, right? So same way here, the interdigital nerve is compressed between the third and fourth metatarsal bones. I think I can give you a good example, right? So carpal tunnel syndrome, right? So what happened carpal tunnel syndrome, right? Here the median nerve is getting compressed in the flexor retinaculum. So same way here the interdigital nerve is getting compressed, right? So interdigital nerve is getting compressed between the third and fourth metatarsal bones due to the abnormal biomechanics or due to the abnormal application, right? So in this neuroma, right? So this Morton's neuroma involves the thickening of the tissue around one of the nerves leading to the toes, right? So generally because of these abnormal forces or abnormal friction in this nerve, which produces a heart produces a tissue formation around the nerve fibers, right? This can cause a sharp burning pain in the ball of your foot, right? So it produces a referred pain in the ball of the foot. So this clinical condition is known as Morton's neuroma. So the person may have pain in the ball of the foot and in the point between the third and fourth metatarsal bones. The toes also may sting, burn, or feel numb, right? So sometimes whenever the nerve gets compressed, the person shows the neurological problems like burning sensation, and sometimes it produces a numbing sensation. And generally, they have identified that wearing the high heel shoes, right? So generally, the females who are wearing high shoes, right? So high heels shoes, which produce the problem, right? So this is the main cause, right? So high heeled shoes have been linked to the development of Morton's neuroma, because whenever they use the high heels, the force is passing through this area, right? So the transfer of force will be between the third and fourth metatarsal bones, and which may lead to this problem, right? So you can see the effects of high heels on the body, the patient. So what are the symptoms, right? So the patient shows, right? So the patient complains of pain radiating into the toes, right? So the pain will be radiated to the other parts of the toes, right? So from first toe to the another toes, associated with pain and numbness radiating into the toes. So the pain will be increased by forefoot weight-bearing activities and the narrow fitting with wear, right? So, and those who are wearing the narrow foot, narrow shoes or narrow chappals, which may produce the problem. So how to examine, right? So the examination is just to palpate the region. So I have shown a picture. So you just palpate that area, right? So the patient will be having the localized tenderness, right? So you can see if you press that region, the player or the person who is affected with Morton's neuroma have the localized tenderness, right? So when you press that area, the person will feel the pain or tenderness in that particular region. So in the chronic stage, palpable click on compression of metatarsal heads, right? So you can feel there's a click sound, right? So you can see whenever you move the hands, right? Whenever you move your thumb, you feel a click sound, right? So because the structures become hardened, right? So the soft tissue is formed around the nerve fiber and it produces a click sound. And the excessive pronation contributes to metatarsal hypermobility and impingement of interdigital nerve, right? So when you make the pronation, right? So when you make pronation of the ankle joint, so it compresses the nerve fiber and it produces the impingement of the interdigital nerve. So these are the examination procedures to identify the problem of Morton's neuroma. So let's see the management, right? So I will tell you the superficial things, right? So what are the management? Same. you can apply if the stage is acute stage, right? So you can apply the ice for the tenderness, right? If you find the person has the tenderness over that particular region, so you can apply ice. And the plantar metatarsal padding, right? So this is a cushion, right? So you can see this picture. So this is known as pad, right? So this is a cushion pad. You can apply inside the shoes or in your footwear, right? So in the footwear you can apply this. This is made up of silicone, right? So this is the metatarsal padding is used to spread load over the metatarsal bones. And intrinsic foot muscle strengthening exercise improve the transverse arch, right? So you can teach the foot exercises, right? So you can teach the foot exercise to the patient to increase the strength of the muscles in the foot region. And in the physical therapy department, you can give ultrasound, right? Ultrasound with phonophoresis, right? So phonophoresis means application of the drugs through the ultrasound. And in the massage, you can give deep tissue massage, right? So you can give deep transverse friction massage and the general stretching exercise for the foot region, right? Ice is beneficial to decrease the associated inflammation. So this is the treatment if you find a person within the stage of acute stage, right? So the next one, the person who is in the chronic stage, right? So acute stage means you can say if the pain is persisting less than a week, or you can say in the less than 7 days, right? So if the player experience this pain, right? So how you can discriminate acute and the chronic stage means the acute stage means the pain which is persist less than less than 1 week, or you can say less than 7 days. You can say it is acute stage. Chronic stage means you can say if the pain persists more than 2 months, you can say, and the stage between 1 week to 2 months, you can say it is a subacute stage, right? So the treatment you can select the treatment according to the stage, right? So if you find a person with chronic stage, so what does it mean? So the patient has pain more than 2 months, right? So in such cases, the person is indicated for corticosteroid injections, right? So hydrocortisone injection and local analgesic agents with padding is done, right? So you can see the picture how the area, the third and fourth metatarsal bone is stabilized or supported with the help of a pad, right? So you can use the orthosis, right? So orthosis for excessive pronation. So in case of no response, surgical excision of damaged nerve is indicated. So what does it mean? So the initial stages, right? So you can go for the conservative treatment, like you can go for rest, ice, padding, orthosis, or you can go for the medical treatment like application of corticosteroid injections or oral analgesics, right? So if the patient is not reacting, or if the patient is not positively reacting or positively giving the good response to your treatment, finally the person may be indicated for surgery, right? So in case of no response, the surgical excision of the damaged nerve is the final treatment. So you can see the removal of the nerve, right? So the removal of the interdigital nerve, right? So the surgical intervention, right? So I think this is not important. So this is just for the information, right? So neurotomy with nerve burial, right? So you just remove the nerve fibers, right? So this is one of the surgical intervention for the Morton's neuroma, right? So the transverse intermetatarsal ligament release, right? So in some cases, there is a chances of tightness of the ligament, right? So you can remove the ligaments. So because these are the structures which may injure the interdigital nerve, and the person may suspect the Morton's neuroma. So whenever if the patient is not reacting for any type of conservative management or any medical management, so they may be indicated for the surgical intervention, right? So the surgical intervention is the last method of treatment for this patient. So the endoscopic decompression of the transverse metatarsal ligament, right? So these surgeries can be performed with the help of endoscopic surgeries, right? So this is the final stage of treatment, person who is experienced with Morton's neuroma. So let's see some of the important taping applications, right? So these are the support, how you can support the structures with the help of straps or with the help of adhesive tapes. So we have come across with two different right? So far we have discussed about two type of sports injuries. One is turf toe, and second one is the Morton's neuroma. Uh, and the third is the foot blisters, right? So foot blisters means uh, this is not a sports injury, right? So this is a common complication, right? So this is a common complication of any type of sports, right? So the foot blisters that you can suspect in most of the players, right? So it is one of the skin reaction, right? So one of the skin reaction in cases of any type of games, right, or in the sports. So the foot blisters are a common problem for athletes and active people and can cause significant pain depending on their size, depth, and the location, right? So these are the common problems that you can, according to the size, depth, and the location. Improper management can lead to tearing of adjacent skin tissue, infection, bleeding, and increased pain, right? So if you have not treated, right, so if you have not treated this issue, right, if you have not treated this problem, foot blisters properly, so which may produce infection, right? So it may leads to infection, and the structures become bleed, and it may produce more pain. So what are the causes, right? So what are the causes? As a physical therapist, you should know what are the causes, because as a physical therapist we have many more role in this region, right? So because it is caused by friction and shearing forces, right? So in the between the skin, so the friction causes the layers to or layers of the skin to separate, right? The skin has two layers like epidermis and the dermis, right? And if the external hard surface is rubbing over the skin, what happens if there is a more amount of force, right, which separate, and these will separate the skin surfaces like between the epidermis and the dermis. So what happens in between? It produces a fluid structure or blood between the skin. I'll show you the picture, so which will give you a clear idea about the blisters, right? So you can see this picture. A person who has had a blister in the greater toe, right? So you can say it is a hot spot, right? So the blisters start as a hot spot, right? So this area become reddened, right? So initially the area become reddened, and again still if the shearing force or the friction force is continuously applying, so what happen? It become or it forms the blisters, right? Initially the skin area is tender to touch and becomes red and irritated, right? First initially the area of the skin who they has more friction or more shear force become red and get ruptured, right? So if the friction continues, then the layers of the skin separate, filling the area with fluid, right? So this area will be filled with fluid. It is the pressure from the fluid that causes the pain. Because of this, what happen? It produces the pain because the pressure stimulates the nerves and other skin surfaces, right? You have pain-free nerve endings, right? So you have pain-free nerve endings below this region. So whenever if there is a direct contact, so which produce the pain sensation, right? So the gymnast, so this is the common information, right? So gymnastics players who are doing gymnastics are players who are involving in the baseball and fast pitch softball pitches, or any type of athletes like the basketball, the soccer, football, volleyball, and tennis, who are more prone for this problem, right? So see the management. The management is very simple, like wound management. So what you have to do, just clean the area thoroughly with antiseptic soap, right? So use some good antiseptic soaps and clean the area, and just gently pressure the one side of the blister. The blister means it is covered with soft tissues, and you have to pressure one side and make a hole in one side, right? So create a small hole at the base of the right side and remove the fluid. And what you have to do in the fourth stage, right? So you apply the sterile gauze pad, right? So push the fluid, or remove the fluid from the blister and apply the sterile gauze and cover the blister, right? So this is same like wound management, right? So this is the management. and wrap the areas that are most prone to blisters with a protective splint or bandages, right? So, this is the protective methods, right? So how you can protect or how you can prevent the blisters, right? So how you can prevent, you have protective splints are available, right? So either protective splints or you can apply the protective bandages. So this will be helpful to prevent the foot blisters. Or you have for the ankle region or for the foot region, you have a special type of socks are available, right? So special athletic socks are available. So you can suggest the athletes or the players to wear such type of special athletic socks, or place moleskin in the heel area, right? So you can see the picture, right? So you can means this is friction-free adaptive devices can be used in the shoes, right? Or sometimes you can use some lubricants, right, in order to reduce the frictions, right? So these are the common protective methods or protective measures that you can take to avoid the foot blisters, right? And next one, the fourth issues that you can commonly see in sports persons or the sports athletes are bruised heel, right? So the bruised heel means, right? So today's lecture is all about only the issues, right? So the issues or the injuries which are related to the foot region, right? So this is the fourth problem that you can commonly see in athletes, right? So that is bruised heel. So in this case, the calcaneum is the bone, right? So calcaneus is the bone is more prone for this problem, right? So the calcaneus is the bone in the foot that bears most of the weight bear during the heel strike, case of an athlete forward movement. I think you might have studied about the normal gait mechanism, right? So this gait mechanism starts with heel strike, foot flat, right? Right heel off, hook off, right? So you have stance phase and the swing phase, right? So in the stance phase, you have the first stage of the stance phase is heel strike. So whenever the force, right, so the weight of the athlete is transferred from the tibia through the talus, right, so the force of the body, right, so whenever you are walking forward, right, so whenever you are doing the forward movements, what happen, you started with the heel strike, so the force is starting from the upper body and it is transferred through the femur, go to the tibia and passes through the talus and to the calcaneus during the heel strike, right? It is transferred through the other small tarsal bones. So this is a normal mechanism, right? So in the normal gait, right? So there is a more probability because the calcaneus is the structure which is conducting with the floor or conducting with the surface, right? Sorry. So the calcaneus is at the risk for injury, right? Because this is the bone or this is the part which is contacting with the floor. So the ground reaction force is passing through the calcaneus. So there is more possibility or more prone for injury at this region, right? So you can see the calcaneus is at the risk for more injury because it is the sole bone that makes initial contact with the ground when the athlete walks, jogs, or lands from a jump. So, this is the bone, right? So this bone should be very strong, because the whole body weight is transferred through the femur, transferred through the tibia, transferred through the tarsal bones, and passes through transfers through the calcaneus bone. So there is more probability of getting injured to the calcaneus bone. Surrounding the calcaneus is classic adipose tissue for the purpose of cushioning and protecting the calcaneus from impact injuries, right? Generally you have a purd, that is known as bursa. Bursa means you can say the soft tissues, right? So the soft coverings, right? You can say adipose tissue, right? It is made up of adipose tissues which provide the cushioning effect, right? Which provide the shock absorber effect to the calcaneus bone. So if this structure is injured or if this structure is not working properly, there is a more chances of getting injury to the calcaneus bone. So a heel injury can include a range of injuries from mild to moderate to severe, right? So in cases of mild injury, you can say only there is a bruise, right? So only the slight rupture of the blood vessels. right? In the moderate, you can see there is a stress fracture of the bone, or in the severe cases, you can find there is a fracture of the calcaneus, right? So the severity of the injury depends on the amount of the force placed on the calcaneus, right? So, if there is more force, right? So if there is a more force which is passing through the calcaneum, you can find more injury to the calcaneus, right? So you can say the severity of the injury, that whether it is mild or moderate or severe, right? Same like turf toe, you can say, you can classify this issue, right? So bruised heel into three types. You can say the mild, moderate, and severe. In mild, only there is a slight rupture of the blood vessels around the calcaneum, or in the moderate, you have a fracture, right? So stress fracture or bone bruise, right? So slight crack fracture in the calcaneum, or in the severe, you have a total complete fracture of the calcaneus, right? So the severity of the injury, that depends upon the amount of force. An injury resulting in a heel bruise may result in pain. So always, whenever there is any abnormal changes in our body, the first symptom is pain, right? So, may result in pain during walking or weight bearing, right? So you have severe pain in the calcaneus region, and you have a swelling in and around the heel, right? So swelling in this area, and if you palpate that area, you have a tenderness. So injury to the heel, right, pad might also result in displacement of the heel pad, right? So there is a cushion I explained you before, right? So there is a pad which is present below the calcaneum to provide the cushioning effect or shock absorber effect for the calcaneum. So if there is any injury, right, so there is a displacement of this pad laterally and medially, so it can go in any direction, right, resulting in a flat spot under the calcaneus compared to the uninjured foot, right? So you get the flat foot, right? So what are the specific factors, right? So what are the causes, right? So generally, what are the causes for this problem, right? So excessive body weight, if the person is more weight, or generally if the age is more than 30 or about 35 years, that is depends upon the age. There is a chance, or poorly cushioned or worn out of running shoes, right? So if the shoes are not properly, right? So if the footwear is not properly, so, or if the person is undergone repeated training or more training, right? So increases in training, or if the surfaces, right? So if the surface is very hard, or sometimes if the surface is uneven surfaces, right? Or walking or training on the barefoot, right? So these are the some of the possible causes or possible factors which may lead to bruised foot, or you can suspect the fractured or bruised foot, or you can say it is a fractured calcaneum. So what are the management? Pain and pressure relief techniques, right? So you can pain relief techniques, right? So you can go for hot water treatment, right? So in the early stages, right, if it is in the acute stage, you can go with the cold treatment, or in the later stages, you can go for the hot water modalities to relieve the pain. And pressure relief techniques, right? So you can go for the protective measures, right? So with the help of soft cushioning shoes, right? Or biomechanical corrections, right? So through application of orthosis, right? So you can provide some orthosis, right? And foot orthosis, or you can go with some type of taping applications. I will show you in the next picture how to apply the taping, right? And you can go for some exercises for the foot region, and stretching of the muscles for the plantar muscles, especially, right? And massage, deep transverse flexion massage, and strengthening exercise for the lower limb, right? So lower limb muscle strengthening exercise, and you can, if there is any if there is any changes in the proprioception, you can go for the proprioceptive and balance exercise for the foot region. So I will show you some of the pictures, right? This will explain what are the common exercises that you can perform for this person, right? So you can see the prone hip extension exercises, towel stretch exercises, right? Standing cat catch stretch exercises, right? Plantar fascia stretching exercises, right? Achilles stretch exercises, and can roll exercises, right? And the second picture, right, which shows how to apply the strapping, right? So which give the protection for the calcaneus bone, and it give the protection for the soft tissues around the calcaneal region, right? So this is adhesive taping, or you can say this is strapping, or you can say adhesive taping or strapping for the calcaneus or bruised heel. So these are the common problems we have discussed so far in the foot region. So the next one, the last one we are going to talk is athlete's foot, right? So the athlete's foot, it is a common dermatological problem. It is not related to physical therapy. Still, it is a major issues, right? So that athlete faces usually. So I would like to add this in this sports injuries, right? Right. So the athlete's foot, you can say it is a tinea pedis, right? So the name of this problem, you can say tinea pedis. It's one of a fungal infection, right? So fungal skin infection of the foot. Most athlete's foot is caused by one of the two types of fungus, right? So these are the two virus, right, which may produce this problem, right? Trichophane metagrophytes and trichophane rubrum, right? So often causes two web or vesicle infections, right? So the infections appear suddenly, is severe and is easily treated, right? So the first one, it comes very fast, right? But you can treat very easily. The second one causes necrosis type infections. This condition lasts for a long time and is difficult to treat. So these are the, just try to understand the name of this virus, right? How this, right? So this fungi, right? So the fungi thrive in closed, warm, moist environments and feed on keratin, a protein found in the hair, nails, and skin, right? So you can see between each course, right? So this infection will, this is one type of fungal infection, right? So a keratin found in the hair, nails, and skin. Rarely athlete's foot can caused by non-dermatophytes, right, like yeast, right? So just try to understand some important information related to athlete's foot. But we have no role in this problem, right? So it is purely a dermatological problem. But as a sports physical therapist, we should know, we should understand this problem also, right? So the common symptoms, there is a peeling of the skin, and you can see there is a cracks in the skin and scaling of the feet. Right? So these are the common symptoms that there is a skin peeling, and you can find there is a crack in the skin, and you can find the scaling like structures will be removed from the skin, and you can find the redness, blisters, or a softening and breaking down of the skin. So what are the symptoms the person shows, right? Itching or burning or both, right? So the person feels continuous itching of the particular region, right? So the treatment is purely the medical treatment, right? So the treatment for athlete's foots are available in a range of formulations, like you have fungal ointments, right? So ointments, or you have creams and paints, sprays, and powders, right? So these are fungal powders, sprays are available, right? The powders are usually recommended for dusting into the shoes, socks, and the stockings to prevent the recurrence of the infection ones, right? So generally, the powders are available. Candida powders are available, right? So these powders are applied inside the shoes, inside the socks, before wearing, right? So now it will give the preventive, one of the preventive measures to prevent such athletic foots. The powder formulation itself helps to inhibit the propagation of fungi by absorbing the moisture and preventing the skin maceration, right? So the application of powder will provide the friction-free movements in the leg, and it prevent the, or you can say it stop the propagation of the fungi. So I will tell you some of the important medicines which we have to take: antifungals, keratolytic agents, and other antimicrobial compounds, right? So these are the very commonly prescribed drugs for the athlete's foot, right? So I think that's all about the